All right, so I'm here with Kyler Brown, who has been managing all of my PT recovery since shoulder surgery. 9 weeks on now.
Yep.
Okay, so we're here in week 9, and Kyler's going to explain kind of what the progression has been like to get here. I think everything prior to this has been kind of boring. I've put up a few videos on Instagram of isolated things I've been doing, but I think really week 8 was when kind of my progress took off, and Dr. Barron kind of took the reins off a little bit on what we could do. So anyway, how did we get here? What was the progress?
Yeah, so basically, the first few weeks after any procedure, you really want to focus on letting those anchors take hold, let the surgery do what it was meant to do. So it's a combination of healing and then very safe loads. Obviously, once we got you out of the sling and started incorporating ranges of motion, Dr. Barron kind of guided us on how much range we were allowed to do. And early phase, again, in that anchor healing stage, you don't want to force the issue or push it. Dr. Barron did a really amazing job for us in that he didn't overly tighten it. He was very mindful of the athlete 1 or 2 years from now, not just healing his surgery. And so with that, we knew that we could actually keep it conservative. We didn't have to force for range, because range of motion has never really been your problem. You cannot have strength without good range of motion, and so having that as a foundation has been critical. At this stage now, like you just said, around the 8-week mark, Dr. Barron kind of took the reins off where we could actually start to go for more ranges with different loads. And so we've been very focused on load foundation based without pushing ranges of motion that could aggravate the tissue. The shoulder is the most mobile joint we have. It is incredibly complex. And so what we've been doing is very progressive loaded isometric strengthening in different angles, but we're not doing those in combined motion because of that glenohumeral joint being so articulate. We need to make sure we don't create creative motion. We want to make sure we load it in all these different angles.
Yeah, so let's show people a little bit of what that is. So when I first got clearance, in the first month, the most I could do after 2 weeks was below 90 degrees, kind of dangling. Mm-hmm. But when we really got the clearance to move, I feel like it was 5 or 6 weeks when we could move in 3 directions, right? So show people the 3 axes we were allowed to move in, starting at about 5 weeks.
Yeah, so basically at 5 weeks is essentially simple flexion, which is taking that glenohumeral joint towards you, some extension, but being only mindful of this anterior shoulder, because that's where the repair was. A lot of people do this even on a simple bent over row. They come too far back with it, throws that glenohumeral forward. We would put stress in that area. So any extension we got had to solve the problem of not allowing this to push.
Which for me is a really big deal, because I had a huge anterior stabilization.
Correct. And everyone's more unstable on the front side of the shoulder, regardless of injury. And so that's just kind of a take home, is you don't want to overstress this area ever, especially if you've had a sublux event or dislocated your shoulder.
And it's worth pointing out, I've seen people put videos up who have had like a slap repair, and they're much more advanced than I am. And so everything we're saying here is really customized to my repair. But I had 270 degrees of repair, basically 3 o'clock to 6 o'clock, 5 anchors, incredibly unstable joint. And that's why Dr. Barron was like, look, we're not going to be able to advance you as quickly as someone that just had a little slap and ready to go.
And specifically not advance you in ranges of motion.
Yeah.
But we did know the ranges we could control. And again, to your point, we should always kind of keep reinforcing that we want loads to be based on your prerequisites and how you advance. You don't just dump straight into doing a 15-pound or whatever. You got to build from the base.
So we got flexion is here. And then what are the other 2 things that we started to introduce in isolation?
Abduction, less than 40 degrees. But what was great about him and the surgery he got, which was amazing, is we very quickly got significantly more abduction, right? And then later we were able to start adding the internal and the external. But we didn't do it with a ton of load early. We just flossed that range with Dr. Barron's advice. And then now what's great is we're loading it in the middle of those ranges, because you want to have not that corner exposed and load it. We want to put it in a nice neutral safe place and then load it. And that's how you build the strength side of it in concurrency with the joint stabilization.
Yeah, so at about 5 weeks, we just started moving, and I was basically walking around the house with a bamboo pole that I would use to hold on to get my flexion, to get my extension, external rotation, and then to get my abduction. And then at week 6, we began isometrically loading that. And then basically did that until about now. So now we're actually going to progress to something even more.
Yeah, and so today's appointment, we're following up, and we really want to activate the tissues that we're going to use And so today's session, we're going to really kind of do some loaded isometrics, not really to fatigue, we just kind of turn the lights on, if you will. And then we're going to tap into your deep stabilization system with some cuff. And then last, we'll isolate the rotator cuff itself because we got to make this thing really strong.
Yep, let's do it.
Okay. And so doing these exercises that don't look that fun, but are so foundational, is the magic sauce. So many practitioners rush it because patients get impatient. I think the number one thing people need to focus on is getting that huge wide footing and base. How's that feel?
That feels good. I mean, I can feel how fatiguing this is. Yeah.
And not the first 15 seconds, but around 30 or 40 seconds, right? Okay, go ahead and rest. And really be mindful here, I don't want this angle above 90, right? Because you're going to get some bicep with this.
Okay.
That's nice. How's it feel? You obviously feel this more.
I feel a little more in the bicep tendon,
Mm-hmm.
even though I feel relaxed here.
Sure.
So really, I'm kind of focusing, obviously, on stabilizing here and trying to keep the shoulder unshrugged.
Correct.
And trying to keep the scapula almost pushing.
Yeah, I like that idea. You're always thinking of the connection of this entire scapulohumeral area connected to your body. It's not flying out away from you, right? And rest. And wrapping around the front.
And so we're going a little less than 90?
Yeah, a little less than 90. So again, it's pure cuff. And he's just trying to take those fingers into the bar. It's an isometric load for the cuff itself. So we're basically doing isometric loads here just to activate and warm up all the tendons in a very safe position. We've done flexion, extension, abduction, and now I'm isolating our cuff. So we're going to go external and then internal. Any burn there? Good. Because I don't want to
And what's the
overly
RPE we want here?
On this one, a 2 to 3, because this is our first round, right? I want to save juice in the tank where we isolate with loads, with right tempos and all that stuff.
All right.
But I'm switch it.
Yeah.
Good. So I just turn around. Oh yeah, that works good. And this one, the internal range of motion, is one of the easiest ones we can get kind of a faulty pattern.
Yeah.
So really just be mindful of that unshrug.
That's been the biggest thing I have been thinking about this week is everything I'm doing is catching the shrug, stopping the shrug. Maybe explain why we are so prone to do this in our weak state.
Sure. In your state specifically, whenever you've had an injury as chronic as yours, your body finds other pathways. It's just like water going downhill. It's like, oh, I don't like that route, I'm going to go this way. And now we've repaired it. Technically, surgery by itself is an injury. So we've had the chronicity of your first injury and then the surgery. So your body needs to relearn, hey, this is how we want you to do it. I don't want to let you just have sloppy patterns because your body will say, you know what, I don't trust these structures. This middle trap though is nice. It's big, it's strong, and I can keep this thing solid by just shrugging up. The problem with that is we get secondary things. We get neck pain, we get headaches, we get bicep tendonitis, all these other things. And so as we relearn this activity, it's sacred to make sure we drive home this idea of where it's supposed to be. But at the same time, your body's so intelligent, it will figure it out eventually. That's good. So then go ahead and look straight ahead. Give me more of a neutral neck, kind of DNS principles, and upright this. Good. And then we're keeping this kind of there. How's this feel in the front?
Actually, just the usual leaky pain that I would describe it as.
And then no more than 2 pounds of pressure. I want you to drive this elbow into the cushion. And you should feel all this kick on. See if I press here, these muscles are really strong and tight. And now what I want you doing is breathing, trying to feel your whole rib cage in the presence of that tension. Yep. So now just relax it and rock your body upward. Give a little micro break. You can relax this pressure too. Good, feel right? And then drop it down again and press the elbow down. Good. Upright that spine. Breathing here, filling your entire rib cage. And while that fills here, this shouldn't change.
So really the focus here is how connected this is to this. I'm almost using the lat to pull it down.
Correct. You're using the lat and some of the other external rotators like teres major here. And what we're doing is basically putting them in a lengthened position. So I'm actually stretching that muscle a little, and then I'm making it contract. And so what that's going to do is it's going to allow my body to understand that this length it needs to adapt to, while at the same time...
So strength at the end of range.
Correct. We're strengthening full ranges of motion. We're progressing towards that. And that's why someone like you have this lat tightness. Hold, keep those elbows in, a slightly isometric external rotation. Okay. So the key with this one is a lot of tension early. It's a leg hair special. Good. We're going to crisscross it underneath. Now each hand gets to grab it. Good. So now this is going to be a DNS type exercise while we integrate some external rotation. So basically core facilitation of that deep stabilization system while also accessing the cuff what we want to be doing. What I'd have you do is bring your knees, your femurs a little more vertical. Good. These are fine. Maybe give yourself a little less. There you go. Drop these elbows down. Great. Next little chin. Good. Now focus on that kind of deep stability, core engagement, and just breathing. So let's try to do no change in your extremities and try to do that roll. Good. And then come back. And what we really want him to feel is that deep stabilization, that link between one shoulder and the opposite hip. So if this hip comes off the ground, this shoulder will come off the ground. What you'll see, it's kind of subtle. He's really good going this way, right? This shoulder and this hip are totally connected, but if he goes the other way, this right shoulder lags. And that's because one of the things that's very common with this is that deep stabilization, that contralateral pattern, if you had an injury or surgery, doesn't kick on as easily. And that's the goal of this drill, is to get him to get familiar with letting this come with this. What's your RPE right now?
6, 7.
Good, let's go ahead and rest. But when you do it, I really want you, does that make sense to you?
Yeah.
Because when you're going left, I want that to come, these two are connected.
Yeah. Yeah.
Like the, and actually your hands are going. Those elbows at your ribs, that's great. And so he's in control of how much tension is happening in his shoulder. At this stage, he's got a lot of strength already, but we don't want to get it too tricky and out far from his body. And now what I want him to do is just focus on that breathing. Bring these femurs down a little bit. Good. Hand up, feel a little higher. Good. Give me 2 to 3 really good breaths where you're expanding that diaphragm, keeping everything strong. Shoulder feels okay?
Mm-hmm.
This should be tight as it is. That's good. And then once he feels like he's connected and he's not getting too tired, now what I want him to do is be that roll cage where he has to roll and control it, going both directions. And what he'll find, and he'll probably tell you he feels, is coming towards me, he's very connected. Going away, this right shoulder lags. Well, guess what? We know why. That deep stabilization system isn't totally intertwined with the shoulder yet. One of the biggest things people miss in rehab is they only work on the shoulder. If I could wave a magic wand and have everyone do some deep stabilization with their rehab, if it's a total hip or a shoulder labral repair, it would be integral in their changes. Do 2 more for me. Focus on unshrugging shoulder. Focus on this. Very good. He's doing a really good job of being mindful this area stays strong and intact. More. Go for it. Good. Come back. Stop in the middle. Go that way again. Really go for it. You got it. You got it. And bring it back. Use that. There you go. And rest. That was good.
Yeah.
So another important kind of principle with this stuff is the shoulder blades always work in concert and apart from each other. And so the way we're kind of building today's session is we're going to now do some isometrics where both shoulders are engaged at the same time. And we're going to change your hand position because that actually rotates the humerus a bit and it helps us isolate different tendons of the cuff. So let's go ahead and start with neutral. Nice and tall, all the same rules with that pillar strength. Come out, hold for about 20 seconds. Good. How's that feel?
I love this position.
Yeah, I mean, this position we've built a lot of confidence in, but also you're getting a lot more strength. And again, this goes in that very tedious but crucially important phase of loading time under tension through these tendons. Do 5 more seconds. What's your RPE here?
2.
Great. First set, I don't want a 7. Right. Go ahead and take a break. We'll do about 15 seconds here. Next one, you're going to go palms down. And go ahead. Good. How's this one feel?
Also good.
Nothing up here, right? Good. And you can tell, I love this therapy. A lot of people know this, but it's called an external cue, where I could tell him all day how to position his shoulder. But what I need to do is come over here and okay, this is nice and soft. He's not using his pec too much, but this stuff is on fire. And that's what I want. Okay, rest, 15 seconds. Now we're gonna go palms up. You see it's prone to be a little more bicep here, but again, when I press, it's soft. That's perfect. He's not engaging, he's not assisting with his biceps to try to create that motion. A lot of people will go bicep and trap to try to accessorize that external, but right now he's using everything on one. 5 more seconds. How's the RPE?
4 or 5.
Good. And rest. Good. So the last one, the most kind of strong position we're going to finish on, I think we go towards a minute if we can, or 7.5 RPE. What I love about this grip, obviously he's stronger there, but we can monitor this. He's definitely starting to get a little shake, but that's fine because it's really safe for his arm. Go ahead and rest. It was a minute, 5 seconds. That was a killer. So I'm going to have Peter do. We also have a band here to activate the hips a little bit more. We're going to do a kickstand RDL. So I really like his chest over, like almost like a single leg RDL. Good. Nice, clean rules here with all the isometrics we've talked about. And then he's just going to lift and place that back leg. And he's really got to feel like this whole left leg is rooted. His arch is working. That's terrific. Eventually, I want to see him start to get some left glute, left thigh kind of ache and soreness there because we're loading that single leg stability while at the same time loading the shoulder. It's a high payoff exercise for someone who's kind of limited in the total capacity they can work out, and it really helps us link that whole chain. What's your RPE here?
I would say it's probably 6 in the hip, 5 in the cuff.
Great. We're going to finish him with cuff isolating, so I love it. Not too much tension here, and really having the hip be the major burden on this one. Give me 2 more taps. Good, rest. Key thing to watch for, take advantage of this angle, is as they fatigue, right, they create an arch here. They like to use these strong external or extensors to help stabilize. And so Peter always being mindful of that interior kind of compartment being braced and strong, not dumping into that low back. It's very crucial. Partly the natural way Peter's built, but also generally speaking, you want to see this a little more flush and having the rib cage kind of come up against that scapula. The reason you can see his here is partly because of muscular development, but also just the way his scapula and his ribs are shaped. Rest. Again, being really mindful.
The shoulder shrug is so tempting.
Totally. Especially now that this cuff is getting tired, right?
Yep.
And I actually have a little good amount of tension here because I want his body to have to figure this out as long as he can maintain a position. I don't want this humerus traveling back because like we said earlier, the ball of the humerus will fly forward and put stress in that area he had repaired. First things first, and I rotate right just a little. Good, because I like that linear angle. Feeling strong here, squeeze my finger. Yeah. Great. Now, let's kind of incorporate some stability. So go right knee up. All your stability in your mind should be coming from here and here, and then this single leg glute over here. And now what I want is a simple reverse lunge, keeping all that intact. And then come back up strong. 2 seconds at the top. Do not arch your back at the top. Good. In your mind, feel like you're almost leaning forward just a little bit at the top. Like if you're not arching your back, the chest is nice and upright. You should feel like your left leg is doing a good amount of work, and then your shoulder really has to figure out how to stabilize this and connect it to your thorax. We're going to start with that isometric just to activate things and create a little fatigue. And now you're in charge of how far you go. So you're just going to walk in that frontal plane, 1 to 2 steps. The only rule, you probably went a little too far there because you're not allowed to let that change position. You'll feel that load increase significantly, right?
Yep.
So we're going to do about 8 of these where his body has to accommodate for that increased force, but we're not creating motion at the joint. That's a crucial thing for this phase. We're creating adaptation or adaptation of the tendons without compromising in the structure. Hugely important later once we start to stimulate the shoulder and do quick reactive motor control drills because that'll allow those tendons to be aware and ready to increase force. Now that it's kicked on, 5 seconds here is all I need. Then we'll do 8 of the marches. And you're going farther just because there's less tension on the band, but that's fine. We go off the feel.
Yep.
All the best people I've learned from in the rehab world and I've seen it in practice is the program is a place to start, but the athlete that day, how they slept, how they ate, how the tendons recovered, dictates the program way more than, oh, we're supposed to do 15 today, so you do 15. So a big take home, I'd say, for any athlete training or doing rehab, it would be really check in on how you're feeling that day. Don't just say, well, I'm supposed to do 25 pounds, so I'm going to do 25 pounds. Obviously, we all know there's some days where it goes in your favor, you can do 35, but then there's other days where maybe your body's telling you it's only 15.
Yeah, so today was not a great day. I was literally 10 watts low on my zone 2 this morning. And yesterday I was significantly weaker in the gym for whatever reason.
And you said you traveled recently, right?
Yeah, probably that doesn't help.
Yeah. Probably sleep's never quite as good, all those things. So now this is our last thing today. Let's bend both knees up so you just feel balanced and comfortable. We always want to be mindful of that deep stabilization system. So I still want your core engaged even though you're laying down. Early on, we would cue that kind of humerus against the ribs with the towel, but we don't need to at this point because you're strong enough and we know where it's at. And now we're just going to really isolate that cuff and fatigue at a time, okay? So let's start with an 8-pounder. He's progressed to this. This exercise is really hard, so you don't need a lot of tonnage. The goal here, make sure the angle is, a little bit down. Good. Great. Give me 10 controlled eccentrics, stopping just north of neutral. Beautiful. I like a 1 second hold at the top, 3 seconds down, and then 1 second back up. Or this is the one where we can totally blast it and fatigue it out, right? Good. And so I'm fine with it at this stage. I wouldn't want to do that kind of that descending rep in the early part of the workout because we're doing so much. But right now is the time to fatigue this.
And there's not much left.
If it'll fall off the cliff for sure.
Yeah. Like if I do this as the first exercise.
Yeah, you can't do much else.
Yeah.
Good. Give me one more like that. Really slow. And rest. Good. So now a lot of times people will do too many reps in a row or they don't give enough recovery time between sets. So on this one I think we go upwards of 90 seconds, 60 to 90 seconds of recovery.
It's amazing that this is half the weight I can do with the other side, even though my rotator cuff is fine, it's pristine, it didn't need a stitch. Is it just the inactivity that has weakened it this much?
It's part inactivity, but part inhibition. That evolutionary advantage our nervous system and our brain has built up over millennia of teaching us, hey, if there's something repairing or damaged, don't load it too much. Right? That's what our bodies learn how to do. And so now we need to reintroduce these exercises so your body's not only comfortable with it, but we build that foundation up.
All right, so I'm like an RPE 8 or 9 there.
Good. Immediately go to the 5, and let's see if we can get 2 to 4 more reps with the same tempo, finishing on that eccentric.
What I like about this slow eccentric is it's just so much time under tension. I'm in such a safe range.
And it's a great opportunity to kind of talk about dosage. A day like today, where we did a ton of cuff isolation, a great deal of rotator cuff activity and global movement, and then we're finishing with this major burnout for these tendons.
It's amazing right now that you can just, the pain is radiating to such different places.
As he gets fatigued, technique will fall apart. His body's trying to find ways to cheat around this rotator cuff fatigue. And so that's where it's kind of interesting. He's noticing that because he's not letting it cheat, right? One more, give me one more. I can feel this thing working real hard. And drop it. Nice work.